So you talked about bringing patients and their families together. What kind of projects? What did that look like from a technology perspective and from a rollout perspective for you guys?
Well, we were really fortunate to tell you the truth, because we had some great foundations. So before COVID, we already had a great telehealth foundation. We had more than 1,000 programs that focused on things like rural outreach, stroke identification, behavioral health assessments. So we had a very solid understanding of telehealth, and we were actually executing it quite well in a very decentralized way across the health system. But as health systems had some new use cases that amplified really fast. So I mentioned one of them, and that is we went to a no visitor policy. And so not only did we have to figure out how to get the equipment, iPads or whatever, into our ICUs or our med-surg rooms, but we had to train people. We had to get it all running, basically. And so we had Apple was a great partner. We're one of the largest iOS users in the industry, but we still didn't have enough devices. So we literally had tech analysts walking through administrative offices, grabbing whatever iPads they could, going into patients' rooms, and I'm not kidding you, literally duct taping the iPads to IV poles. And it was important. It was important to create the connection between a patient and their loved ones. And honestly, it created a better connection between our care teams and the families instead of a voice call. So that one in particular was pretty important to us. The other foundational thing that we had going for us was that we went down a path a few years ago that we wanted to go mobile. And we wanted to supply our caregivers with a communication platform that we can not only use for voice if needed, but also use for texting and come COVID for the video capabilities as well. So we have about 80,000 iPhones that are distributed across the company that we actually used for mostly the text messaging, but gave us that great foundation in order to operate.